Well, welcome to all of you to this meeting for the Research Master Clinical and Psychosocial Epidemiology. In short, a CPE, that's much easier. My name is Andrea de Winter. I'm a program director of this program, and I will provide you with an overview of the main characteristics of this program. Sandra Brouwer, who is one of the track coordinators, will provide you more information about the tracks you might choose. And since we know that it's quite difficult to decide what research master fits with your interests, your preferences, and your drive, I'm very pleased that we also have students who will participate, and alumni. Julia, Lisa, and Gabriel will also provide information about their experience in this program, and that might be helpful for your decision making. Okay, well, when I'm thinking about the CPE program, all researchers have the similar drive. We want to improve health for all with high quality and innovative research. And most of our researchers within CPE work on well-known health challenges in society. You can think of, for example, the worldwide epidemic of obesity. That's one of the challenges people are working on. But you can also think about the increase of mental health problems among youth. What are the reasons for this? So that's also a challenge people are working on. The large health differences in populations is also a topic we address in this research master. Another topic is, of course, what we see in society, the large increase in chronic diseases such as dementia, cancer, diabetes, or heart disease. But if I think about all those challenges, what these challenges have in common is the fact that we don't have clear solutions for, no easy solutions for those challenges. You could think of, well, these are kind of unsolved mysteries. And what we need are the modern day Sherlock Holmes of science, who really can contribute to getting insight in those problems and also developing solutions. In CPE, you learn to unravel and address these important challenges. You will do that from different perspectives. You will find out what potentially hidden causes are for some problems, and you will contribute to solutions. You will learn how to contribute to those solutions. What we know from experience is that we see a high demand of our graduates because we need people in science who are able to address those complex issues. CPE, this research master, might be a good choice if you like to unravel those complex problems and contribute to solutions. What makes us unique is that we do it from an interdisciplinary perspective. So you will use the methods and the concepts of different disciplines and combine them in research, and that will create more innovative research. You will learn to unravel different factors: biological factors, psychological factors, social and environmental factors. And you will address those if we think about the problems. Our students say, well, epidemiology is quite a complex puzzle. And they find this research master challenging. But they also say that they get a lot of support to overcome these challenges. And I'm very pleased to hear this, because what we want in this CPE Research Master is that you will grow and learn in a stimulating, but also a supportive environment. How will your learning journey look like? Well, one of the unique aspects is that you will build up your knowledge and skills in a stepwise and thematic approach. In the first block of 10 weeks, you will explore the health-related challenges in society, and you will learn to see that from a bigger picture. In the second block, you will assess and explain differences in health in the population, for example, by statistic or measuring concepts, etc. In the third block, we focus on the development and evaluations of interventions, and you will learn that we have different innovative interventions. and how can we develop those interventions and see whether it really improves prevention and healthcare. You will, for example, work with examples like home-based screening for chronic diseases, or new lifestyle interventions, or e-health interventions. After those 3 blocks, it's your turn. You will learn to prepare new and relevant research. All the courses contribute to the theme of each block. I provide here an overview, but we will send you more information about the courses after this session in a couple of weeks, because currently in the system of the university it's not possible to provide the information about courses on OCASIS. We have made some changes in some courses, so we want to give you a real update information about the program in order that you make decisions about the program. A lot of research masters have similar courses, but what is special in our research master is that you will use the knowledge and the skills you have learned in the courses for 4 different projects in project-based learning. In those project-based learning, you will work in interdisciplinary teams and you will work with real-life challenges. We work with those real-life challenges because we want to prepare you for future jobs. So the tasks in those projects will be similar in tasks you will encounter in your future job. So this provides you with the real practical experience as a researcher. To facilitate that you develop research skills, and we are sure that you will develop strong research skills, but we will also facilitate you to develop other professional skills like leadership, collaboration, or creative problem solving. Employees have identified those 3 domains as very important for a successful career, and we want to prepare you for this career and have included this in our program. This is the overview of the first year. And we are sure that you have learned a lot during this first year. Our students report that they are quite proud on their achievements in the first year and that they really feel very prepared for the next phase in the program. And in the next phase in the program, in the second year, you will apply your knowledge and skills in your own research project. It's quite important to mention that this research projects enables you to participate in rigorous and innovative research. And what I would like to stress is that you will work with very special data here in the UMCG. We have quite a leading position here in the UMCG in Europe when we think of our unique databases, like lifelines or trails. So that provides you with very nice options to work as a researcher in a team with very experienced and top-notch researchers. At the end of the first year, I hope that you have sufficient skill to become an independent and successful researcher. We want to prepare you not only that you finalize the research master, most students do that in 2 years, but that you are really feel that you are well prepared for different type of jobs. Within the research master, you can choose your own path. You can do different type of research. And it's important to stress that most students do meaningful and relevant research, and their research also has impact for the prevention or impact for the quality of care. I will give you 2 examples. For example, Karl Peter van Erpicum, he studied the role of environmental factors on obesity in the north of the Netherlands. And he showed that fast food restaurants really had an influence on the obesity. And he also identified people in the population who were more vulnerable For example, he studied genetic factors. His research is an important contribution to think about new policies. A second example is the research from Mateus Silva Gurgel do Amaral. His research helped to improve healthcare for vulnerable groups. He focused on chronic kidney disease patients, and he showed with his research that certain complications arise for a certain group of patients, and that they also had a more adverse outcomes. He developed a new intervention and showed that this intervention was effective, but also cost-effective. So that's an important message to improve healthcare. This is a slide with a lot of words, but it shows the diversity of topics you can choose for your own research, whether it's on mental health, whether it's related to public health, whether you are really interested in the more life-threatening diseases or the more chronic diseases. Some people do it from a focus from psychology. Some people like to do it from more biology perspective. It's about trying. What we do is that you make a decision about your own research that fits with your interests. In this short presentation, I wanted to provide you with some essentials within our program, an overview. I stressed that this program is interdisciplinary and innovative, and that creates a very rich learning environment. I hope that you also understand that we really not only want to improve your knowledge, but that we focus on skills you need in your future career. You really have the opportunity to do very innovative research within the UMCG, but also outside the UMCG. In our cohort, we work with a small international cohort, and students have different backgrounds, and that also creates a more interesting learning environment for our students. You have options to follow your own path, and I didn't mention that yet, there are also opportunities to continue with a PhD degree, your research, if you are selected by the committee in the UMCG. Other students are not selected, but they often also find positions as a PhD or in other type of positions. What we also do in the program is that for people who want to register as epidemiologist A, which is of course unique for your CV, we also facilitate that. I hope this helped you already to have an idea whether this research master fits with your interest and your drive and your preferences, but I think it's good that I give the word to Julia because she can tell more about her specific experiences in the program. Thank you.
Hi, good morning. My name is Julia. I'm a second year student of CPE right now. So I'm writing my master thesis right now, but a little bit of background for me. I'm 23 right now, not 22 anymore, but yes. I'm originally from Spain, and this is my 5th year in the Netherlands. I have a background on health life sciences, which I also did at the RUG. So a little bit on how I decided, on why I decided to choose CPE, which I think is quite important. Maybe some of it resonates with you. I really like the fact that it was a small and international cohort, as it was mentioned. In my year right now, we're only 15, and we're all around the world. There's actually only one Dutch person right now. So it's quite interesting, and it's really nice, and you learn a lot, not just about like small things or like very specific things to research, but also like cultural things, which have been really important to me as well. Obviously 15 people means that the teaching is very personal, and it's very easy to ask questions as well as to learn a lot and to very specifically answer questions that you might have. For me, it was also very important because I wasn't sure if I wanted to do a PhD or not after these. And I felt like the research master, specifically CPE, gave me an opportunity not just to figure out whether I want to do a PhD later on, but also if I didn't want to do it, to have a very good like future set up to continue outside academia. So within CPE, I'm doing one of the tracks called Health Systems and Preventions. We call it HSP. And within it, you also have an internship. And for this internship, you have to do it in non-academic places. So overall, it's been really nice. It was a really nice setup for me to either decide whether I wanted to go into research and get a full hand experience on how it would be, but also get prepared with if I wanted to find a job outside of it. So how did I get to CPE? It's actually quite simple. You can just obviously send your CV and your motivation letter, and after that, you'll be invited to do a statistics test. To be honest, I freaked out a lot when I had to do this test. I thought it was kind of the end of the world, but it really isn't. CPE always sends you some examples of previous exams and also a lot of materials like study books and also like online like access to actual classes from teachers that have given a statistical the statistical course in CPE beforehand. So it's very basic statistics and it's really easy to pass, and that's really all you need to be able to go on to your next step. And the next step that I had to do, and you will have to do if you decide to join, was to do an interview. So in the interview, you just have like 5 minutes and to like present some kind of research project that you've participated in, either your bachelor thesis, if there's enough to say about it, or if you did a project during your minor, anything works out. But overall, it's just to get an idea of your motivation and for you to show why you want to be in the master and why you think it's a good fit for you. So it's really simple, to be honest. And it's very nice and simple procedure that is very explained during the entire time. So once you get into CPE, there's obviously year one and year two, like I was previously explained. For year one, you have foundation courses, which are really nice because they kind of build up um, for you to be able to learn how to independently do research in your second year. And you get to find out about the 4 different departments. So you get a lot of like specific ones for psychiatry, for public health, etc. So it's really nice, and you get to do like study design and like learn a lot about like the different kinds of research you can do, and it builds up during this time. And then you also can do elective courses your first year. Although for me, for example, I'm doing them in my second year. I thought that was easier, but you can plan around it however you want. And also something that I think is really good about the CPE program is we have coaching groups. So coaching groups is your cohort is divided into small groups, and then you have an independent researcher that doesn't have really much to do with the day-to-day in CPE. And you meet up every 2 weeks, and it's a really nice safe space to talk about what is going on, whether there is some kind of frustration going on, or like you don't think things are working exactly, or just as a backup. For example, in my coaching group, we really like presenting like what's going on with their thesis, or like if we had exams like statistics exams, someone would prepare like a question moment, and then we would all be practicing together. So I think coaching group is a really nice safe space because you also see that everyone is going through the same things you're going, and you're not going through it alone. Because obviously this is still a research master. I think everyone is capable of doing it, but obviously it is work and it is hard work. Um, and your second year, which is where I am now, I've done my 2 elective courses because you need to do 10 credits for it. And now I'm writing my master thesis, and I'm also just starting with my PhD proposal, and as well doing my internship. It sounds like a lot, but it is very manageable because I don't really have classes anymore. I just finished my elective. So right now I'm just um, scheduling around when do I want to write each stuff and where do I want to meet my supervisors. So it is quite manageable and it is really fun to do. And specifically into creating your thesis, which is the entirety of your first year, second year, and a little bit of your first year. It's really nice and simple. CPE will provide you with like a booklet of all the supervisors that are available and the projects that they think you could participate in and be part of. So what you do is once you see the booklet and you decide what you like or what sounds nice to you, you interview the supervisors. So it's you choosing them and not them choosing you. So you can have as little as 3 interviews, or you can interview everyone in the booklet if you want it. What is really nice is that there's a lot of possibilities. So you can either go through a very specific research that already has a very specific thing and they really want someone to, in my case, for example, a cost-effective analysis, or you really don't want to have to draft an entire thesis for yourself, Or you can go to a supervisor that just has an idea that they want to do something in mental health, and then you decide for yourself from zero what kind of database you want to use and what kind of research you want to do and what your thesis will look like. So I think that's also really nice because there's such a variety, not just of topics and backgrounds that you can follow, but also on how much freedom you want for yourself and to decide what to do. And for me specifically as well, because I'm HSP and it's obligatory to do an internship, it was really important for me what kind of internship was they were thinking about that could go next to my master thesis. It was something really important during the internship for me. But honestly, it's really nice and it's really simple, and you can, within obviously doing proper research, there's so many possibilities. You can do anything and everything. And if you talk to like everyone in my cohort, you will see we are doing such different things. So it's really nice because it really can adapt to what you want to do. And to close off, just to give a little bit of an idea that there's also a lot of social part of CPE. This is my cohort and, well, mostly my friends right now. And we always like celebrate birthdays together at the study landscape because we have a room designated for us that we share with just the other research master. We like going out. It's a very small cohort, so you always make a lot of friends. My coach group and I were very close, so we also do a bunch of stuff, especially at Christmas and summer. We always do picnics if we can. We go together to lunch, especially this year that we don't have classes together. We are always trying to like find a little break to have lunch together and see each other again. So it is a lot of hard work, but I think it's also very rewarding. And it's, at least for me, it's been an amazing experience to be part of CPE. And that's my little presentation. So if you have any questions later, feel free to ask them. And thank you.
Thank you, Julia. My name is Sandra Brouwer, and I'm the coordinator of the track on health systems and prevention. I will tell a bit more about the two tracks, and I'm also doing this on behalf of Hanneke Wiegman. She's not here today, but she's the coordinator of the life course development track, health development track. Andrea already mentioned, given more insight into the whole program. And what she also showed is that in particular, we are interested in health and the health problems and all the challenges we have to take care of and what we can do as researchers on these topics. But following your own path, we also decided that it's good to have in our research master the options to follow a path which has two directions. So these are the two tracks. I will just start with this. The first one, health systems and prevention. So Julia already mentioned that. That's the HSP track, and the life course health development track, the LHD. To start with the LHD, that's the track which in particular focused on health, of course. But also that you learn more about how chronic diseases and mental health develops also over time, and what the progress over time is, and which kind of determinants influence these trajectories. And all the students in this track, they will also learn how to apply a life course perspective, and also including the type of analysis which are relevant to use to do these type of research. That's just a small part, but if you want to know more and more detailed information, we can give you that, of course, after this presentation. But for now, it's just that is the main focus. And for the health system and prevention, there we apply not a life course perspective, but a health system approach. And there we in particular learn the students how health system thinking can be useful also as a strategy for designing prevention strategies, and also how you can evaluate policies related to health, to evaluate it in collaboration with policymakers, for example. And also here, you in particular will learn also what kind of techniques, data analysis you can use, and also what data sets are available. Well, and with the HSP, we really want to bridge science and practice. So therefore, Julia already mentioned it. It also includes an internship at a non-academic organization, which can be here in the region, but can also be in other countries. But it is part of the master thesis project. So it's not a separate internship, but it is linked to the research project you are doing. So what about the program? Because that means that there are actually, you have the track-specific part, but overall we also have the core curriculum, which is 60% of the program, which all the students from both tracks will follow. So then you are just one group of students, which includes all the courses on statistics, on chronic disease, all different courses which are relevant for both groups. But we have 40% where, and that starts already in the first year, and it will continue in the second year, where you have two different courses. So these are the track-specific courses, where the focus will be on learning more about health systems and the type of analysis you use for that, or the life course perspective approach. And on the next slide, we give a bit more information. So there the difference you can see, it includes the specific courses, which is the first bullet, but also for the electives and the master thesis project, the topic will also be related to this specific topic or focus of the specific track. So these are the differences. Well, already mentioned also by Andrea and Julia, what we really like also and really important for doing this kind of research is a diversity in expertise and disciplines. And we see this for the students, so different backgrounds, but also for the teachers and supervisors who are involved. They have a diverse group of researchers, which is really nice and also really important, where you can learn from each other and also combine it. And that really fits to the idea of that interdisciplinary research we use for this kind of topics. So here you can see the different groups on economics, medicine, sociology, biology. Well, many students, educations are mentioned here. And if you are still, if yours is not on this slide, always you can just contact us and we can help and see if it also fits to your background to the research master. So we are always willing to help. Then about the career opportunities, and Julia already mentioned that at the start she was not sure if she wants to do a PhD and maybe still not sure. And that's for many students, they are not at the start not clear if they really want to have an academic career and continue in a PhD or not. But what we see is that even it's not only this research master, you will not end always in a PhD or in an academic career, but it can also be outside academia, where you will have the right knowledge and skills which are really useful also in careers outside the academia. And here we have some examples where you can see what a career can be when you continue in your research in academia, but also outside. And we have many examples of students who follow the research master who end up or in academia or outside. And that's really diverse as well, and really interesting also to hear over the years where our students continue during their career and which steps they make. And these are examples of organizations, so it's universities, but also consultancies, non-governmental organizations, research centers, knowledge institutes, many different examples. And I think it's really nice also to give a bit more information about that, but that's where I would like to give the floor to the next presenters, our alumni, who can tell about why they choose for the CPE, what their experiences are, but also now what they're doing today in their career. So I'm not sure, Gabriel, will you continue?
Yes, if Maybe with Lisa, if she's able to join with the microphone at least. I don't know if you.
The microphone is hopefully working, right?
Okay, it is.
But you can start first, please.
Good, nice. Okay, so first of all, my name is Gabriel. I graduated from the CPE Master in 2020, and I'm in Groningen, still living here and working here also for a consultancy company. Lisa, go on.
Yes, I'm Lisa. I'm originally from Germany. I do have a background in psychology from the University of Groningen, and I graduated from the CPE program 1.5 years ago, and currently I'm a second-year PhD student in the department I wrote my master thesis in.
Yeah, so we'll talk a little bit about our experience in our CPE journey. I think the other presenters, they already mentioned a lot of relevant things about the master, the interdisciplinary research, the small groups in which like you have personal attention. So I'm not going to be harping on the same strings here over and over, but in some, for me, the overall experience was really good. I didn't mention, but I am a physiotherapist. I'm from Brazil, I graduated in Brazil, and then after some years of practice, I went for the CPE master. I wanted to, maybe combine a bit more practice and research, and the master was a good fit for me. So that's why I joined. And the fact that a lot of researchers there in all the departments from the masters, they combine the psychological factors with environmental factors, public health, biological factors. It all caught my attention. As me, as a physiotherapist, I never liked seeing my patient as just a body, for example, because their mental health affects how they can recover from an injury, for example, or their environmental as well. So this is the reason I joined the CPE. And my journey, I would say, for example, Julia already talked about her experience in the master and was pretty similar. Professors are always willing to help you. Already mentioned by Andrea as well, you have the possibility of using many databases from the Netherlands, from the north of the Netherlands. So there are many opportunities out there, and it was very pleasant to me. Lisa, maybe you can talk a bit about your experience so far.
Yeah, sure. Probably there will be also a lot of repetition. One of the main reasons for me also to join or to apply for the CPE program was mainly the multidisciplinary and interdisciplinary approach, which I was missing a lot during a conference during my bachelor's, in which there were research on psychology, but also medicine. But I was a bit confused about the fact that both disciplines were not working together, although they could have gotten more information out of a combined approach. And I think a few months later, I actually attended a presentation like this about the CPE Research Master, and directly thought this is exactly what I was looking for. So I applied for it, got luckily in it, and did not regret it, actually. We talked about the multidisciplinary approach already, but what I also really highly appreciate is not just only the small cohort, although I had 27 fellow students, so we were a really big cohort, but it was very, very, very close, actually, although we were a bit more compared to the other cohorts. But what I also appreciate a lot, as Andrea already said, there are people from many different disciplines. You're not staying in your bubble of discipline, basically. So for me, for example, just talking to psychology students, I talk to physiotherapists, I talk to people from health sciences, and it's also broadening your perspective on certain things and issues. And furthermore, we have people from all around the globe joining this program, so you also have a lot of intercultural exchange. So you also get a broader perspective in that, which is also a very valuable skill you will have after you finish this master's program, because you also work with a lot of different cultures together from different backgrounds and disciplines. Yes.
Nice. Well, then coming from the journey during the CPE to after the CPE, so let's say after the master, CPE prepares you to become an independent researcher. So from all the basic courses in the first year to you designing your own research, analyzing the data, writing proposals, you are really ready to be an independent researcher in academia or outside academia. So yeah, it's really research from A to Z, I would say. So from the start to beginning, you really learn everything. Something that also, so besides all the hard skills you learn during the masters, all the topics, I would say that a lot of soft skills are useful in, well, any career you pursue afterwards. So I can mention, for example, project management, that you have to manage your own project, time management, as Julia said, for example, that you decide when to have meetings with whom and how often and what should be decided there. So decision taking, leadership, communication. So besides all the hard skills, you also learn all these soft skills that will be very, very useful in your career, no matter where. Yeah, so as you can see some pictures here. I wanted to put some pictures of me working, but I just realized that I just have the professional typical LinkedIn picture and another one from a congress that my colleagues went to. So that's it. All the others are parting pictures, and I thought it was not suitable for this slide. But so I'm currently working as a consultant in a health economics company, but I'm still, as I really like the research master, I'm still very research oriented. So I still go to congresses, absorb a lot of knowledge, try to apply new techniques, and everything that I learned in my work here is still. Lisa, you want to talk about something?
Yeah, sure. I actually had an experience, I think, a few weeks ago where I thought I was still doing a master's degree. So as I said, I'm already a second year PhD student. And for me, as I stayed in the same department, although I changed the topic, I did not realize that I became a PhD student. So I think that's already saying a lot about how well the CPE program prepares you for it. Because basically it's a very small, they're preparing you to become a really independent researcher, very small steps. You won't even really notice how much responsibility you will have at the end. So I think it's a really nice transition. And although you get a lot of responsibility, there's no, at least for me, I never had the feeling it was too much. My supervisors gave me a lot of responsibility, but I always knew, could always contact them basically. And it's really nice to have so much freedom. So I think if you have that much freedom, you also have a lot of possibility to learn and to make your own experiences and to get more confident about what you're doing basically as a researcher. Yeah, so I'm also very happy with my PhD right now. And I think the skills, the courses in the CPE program really nicely prepared me for doing a PhD right now.
Yeah, and it's good to mention that you mentioned that it's you don't see it coming. Let's say that this step by step, and then when you see yourself, okay, I'm an independent researcher, because a personal experience that I can share, Sandra that just presented now, she was my supervisor, and I had my ups and downs during my learning curve during the CPE, and but yeah, the researchers and not project managers, but the principal investigators and the people that are there helping you with your research. They're always really willing to help you and to adapt and to see what you can do to really, like, so your learning curve can really go exponentially after a certain time. But when you're not aware of it, you're already an independent researcher and fully prepared for the next steps in your career. Okay, so then some tips, overall tips. I think we already mentioned a lot of our experience after graduating, but from my personal experience would be the statistics. It's really important. So in case you are planning on applying for it in the end of the year, I think in general students from the RUG, they are well prepared. Speaking of statistics, so I think it wouldn't be a big problem. But it's always good to revise some things. The CPE also sends you, when you're about to apply or go through the process, they send you some documents in which you can also practice a bit statistics. But it's also it's something that you use a lot, I would say, during the 2 years. So it's always good to be really up to date and yeah, good on statistics. The I wouldn't say cultural shock, but it's really the cultural explosion that is going in the whole classroom, because it's so many people from so many places, and it can be challenging sometimes to work with different working styles, but at the same time it's an amazing experience. It's something that you can use also in wherever you're going to work in the future. Such a globalized world, is always good to be aware of how some people can work and learn from each other. And yeah, all in all, I would say that's it. It's was a very, very pleasant period. Some pictures on the left here. It's from my cohort. We were 10, 12, 14 people, don't remember now, but it was such a great period. We are still friends. We still travel together. In 2 weeks, I'm gonna see my friends again in France. And so yeah, besides all the content from the masters, also yeah, what you get from it for the rest of your life, it's beyond this scope, I would say. Maybe Lizzie, you can also share some of your experiences.
Yes, sure. I think first of all, if you really are interested in a CPE program, but you're doubting whether you have the skills well developed so far, statistical skills, you should still apply, in my opinion. If you're generally interested in research, I always say that it's then possible to still learn the skills for it throughout the study, in my opinion. Also, as Gabriel already said, you will make friends for life, basically, because I also have a trip coming up with my friends I met from the CPE program. So that's also very, very nice. And well, in order to make friends, of course, you need to have some free time. So we see it quite often that sometimes people are stressing out new students, and you really don't have to stress out. It is very manageable. And I think the CPE program is also not just about research, of course, but also of having experiencing Groningen and University of Groningen, basically. It's really important to also take some rest. So don't overwork yourself. Also enjoy the time with your fellow students. Sometimes also nice to take some time off. You get new inspiration for your masterpieces. That's also what we noticed and learned, basically. Yeah.
I think that's it, our presentation. I think Flor will take over from here, and yes, I think from now on some questions can pop up. Feel free to ask anything to us. Thank you.
Thank you so much, Gabriel and Lisa, as well, for your presentations. Hi, everyone. I'm Flor Velthuis. I'm the study advisor of this program. So if you have questions also after this presentation in the upcoming days, feel free to contact me. I will show my contact details here on the slides. And before we go to the Q&A, I would like to emphasize another event that is coming up. Next week, we have a meet and greet, which means we organize a very informal session only with current students and alumni, a little bit like today, but then without us as the organization and teachers and coordinators. So it's an informal session. We have one online if you're not able to come to Groningen, but if you join the in-person session, it's here in the faculty in the student landscape. It's the social hub we have here for our students to study, but also to meet each other. And there's lunch provided. So, well, if you would like to join the students and alumni here, again, you see the QR code, scan it, and you can book your spot. So feel free to join us here and see what the faculty looks like, either online or in person. So now I would like to continue to the Q&A. You're also able to raise your hand and use your mic to ask your question live, I would say, or you can use the chat and we will get your questions answered. And I think I see Josie posting the first question. Josie, you're asking, can you tell a bit more about the application procedure, in particular the interview? Yes, I will just show also the slide for all of you to have a bit an idea where we are. So in May, there is still the opportunity, 1st of May, to apply. First, there's the entrance exam. That's the statistics exam, what was explained, and then it's followed by the interview. And during the interview, yeah, I'm not sure exactly what your question is, but I will just explain. And if you want to hear something else, then let me know. But motivation is one of the main reasons this interview takes place, to understand who you are, why you see fit with the program, to get to know you better, to know, like, is this a real fit with CPE or not? So that's the most important part of the interview. So you indeed present also a bit about your research background, but it's really about getting to know you and see where there's a fit or not, and your motivation, enthusiasm for the CPE program. So I'm not sure if that is answering the question you have. If not, then please, you say thanks. Okay, perfect. Anyone else having a question? Yes, I see someone asking. I think it's Josie again. How many hours or work study per week should we expect? Well, I would say, like all masters, we assume a 40 hours work week. That's what we, yeah, and I think definitely this program asks that from you. That doesn't mean that it's all filled with contact hours. Of course, there are a lot of group assignments and a lot of collaborations, but it's also self-study. So it's not that the whole week is filled with contact hours from our side, but it definitely asks a full-time, yeah, work and study approach, I would say. I'm not sure if Andrea wants to add something on that, or Sandra, or maybe the students.
Well, if you look to the number of hours, it's very dependable on the students, their backgrounds, the way they study. We see that some students have about 28 hours per week, but we also see students who use 40 hours per week. And some students who are very ambitious and who want to really want to have a high level, sometimes even do a little bit more. That's what we see. Important is that most students say that the courses, the workload fits with what we expect, so there is not a too high workload in the program. And I think that's also very important for us, that we don't want you to be stressed during the program. We want you to learn and grow, but not to have a too high workload. So that's one thing I would like to say about this question. Because I want also to say something about how to choose a track. I think it's very difficult sometimes. Well, both tracks are interesting, relevant. I want to say two things. In the first block, you will get more information about the tracks, and this will enable you to make a potential final decision about the track. So you choose before your application which track you want to do, but there is the opportunity to change if you have more experiences in the program. So that means that we really want to prevent that the track doesn't fit with your interest as a student. The life course health development track is really new, so it's currently developed with a team of experts in the life course epidemiology. So if you want to know more about these opportunities and what's going on, please contact us, because that might also be more difficult to think about this track if you haven't seen the courses yet of this life course health development track.
Yes, and maybe to add, what also, as I'm also a member of the admission committee, and also as part of the for the interview, there's also the option just to talk about the two tracks, and then we also from the committee also can, well, give our ideas and suggestions for what might fit, or to hear also your motivation and the things you want to do related to your career. But as Andrea said, it's really also, we really stimulate you. If you have any questions about the two tracks, you can always contact us or Floor, the CPE office, and as well as the coordinators. So we can also help and think with you, and also students are willing to help, because that's also really, yeah, you can read a lot about it, but at the end it's good to hear, I think, and get a better idea about what the two tracks are about. But overall, it's also, as I present, it's 60%, which is and the core, which is similar for both groups. Yeah.
All right, thank you for your additions. Maria, you're asking how many applicants do you get each year, and how many students can you accept? Well, usually we have around 100 people applying, and we have, well, the maximum for us is 35, but we usually don't get there, predominantly because, well, many students who apply in the end can't find, for example, a scholarship or don't finish their bachelor. What we see in our experience is that those who have the right motivation and have the right fit with the program usually also get into the program. So don't worry about whether it's 100 or 200 or 500 students applying. If you have the right motivation and you have the right background, there's a place for you. So don't think too much about the amounts and spots available. If we have good students, then there's also fit in the program. And Femke, I think your question can maybe best addressed by the students or the alumni. You're wondering if we can give an estimate of the self-study and contact hour ratio. I think maybe one of the students can pick this up. Or
Yeah.
I think it's something you experience, right?
Yeah, I think it varies from person to person. I think Julia and Lisa maybe can contribute on that, but I would say that all in all, it would be around 40 hours a week, so a full-time study. Sometimes you can have less classes, but it doesn't mean that you have less hours per week, because sometimes you have to dive into something that is more complicated. So then the whole 40 hours will be filled in with self-study. So I would say that all in all, you have busier periods, some periods that are less busy, but all in all, 40 hours a week between courses and self-study. Depends on how many courses you're having by its time. But maybe Julia or Lisa can contribute a bit more on this answer.
I think I agree with you. It varies a lot, also depending on the courses. There are courses. The nice part about this program is as well, usually you have one course, you do the examination if there's one, or an assignment, and then you continue with the next course, basically. But also based on the organization of the course, it can differ among courses. So I remember moments where we had to read a paper that day, or two papers, and the next day we had a lecture, which was very doable. And I think 40 hours per week is, 30 to 40 hours per week is a reasonable time. And self-study contact hour ratio. So I think you have, 1/4 of lectures, and the other one is self-study for most courses, I would say. But of course, also if you're done with your courses and you start with your master thesis, you will have less contact hours. So it really depends also in which phase you are during the CPE program. Maybe Julia, you also want to add something?
I think the first 6 months of the first year are quite intense in like contact hours and study, because you have all your subjects. But for example, the second year really does depend on yourself and your own organization. Like I see my supervisors every 2 weeks, like my daily one, and once a month a big group. So I don't really have a lot of contact hours on my second year. It's a lot of self-study for me and writing my thesis. But during my 2 years, I've worked part-time a 16-hour contract. So I think it really depends on your own, like they said, very individual, how much you need, but also how you organize yourself, because it has been doable to also work part-time for me.
Thanks for adding this information. I continue to the question of Rafsan. I think Rafsan, it depends a bit on the exact courses you've done, etc., to say upfront if you're applicable or not. So I think if you have specific questions about it, I think it's better to send me an email. You see the contact details of me on the slide, so I can look into a little bit into more detail to get your questions answered. And I think the last one, that might be a more general question also for everyone, how to choose between the two tracks. Well, I think Sandra and also Andrea explained, like, we can also help you thinking if you're really not sure which track suits you most. or if you're doubting a bit, we are here to help you out and explain more about the 2 tracks if you need more information to make that decision. So we will, well, there's still enough time to help you out. So also, please, if you have specific questions, send an email to me and I can help you thinking along. So I hope for now that's enough answering your question.
Yeah.
Yeah, Andrea?
Yeah, one addition. It's of course a huge choice to make a choice between the tracks that will inform your path in CPE. However, tracks are also having sometimes activities together, so then you will also learn from the other tracks. So they are different pathways within the CPE program, but there's also a lot of synergy between the 2 tracks. So and that makes it perhaps less difficult to choose for one track, because I can imagine that some people have difficulties to choose because both are very interesting and relevant and are also related to future jobs in the field. So yeah.
I haven't seen any other questions popping up, and I also think due to the time, I would like to close off. If you have more questions after this presentation, again, feel free to contact me. And I really hope that this presentation can help you in making a decision if you want to apply for CPE. So good luck making that decision, and thanks for being here. And if you have more questions, we would love to hear them. And have a good day.